Hello everyone and welcome to this session from International Cat Care, ISFM and Cat Care for Life webinar on elderly cats. And now it's absolutely fantastic to see so many of you joining us from all over the globe. So I just want to give you a few tips to help you get the most out of this session before we start. If you check out the resources tab, you will find your CPD certificate as well as a PDF of the slides for this session, which you can download. We also have a test your connection button, so if you have any problems at all technically, then please do use that to be able to test everything and get further support if required. The session is being recorded, so you will be able to watch again at any point once it's finished today. So don't worry if you miss anything, or if you want to come back and revisit, or you want to come back and download the slides or your certificate. You can do that at any time. You don't have to quickly try and do that now. There will be time for questions at the end of the session. There is a chat box in the bottom corner, so please do use that to type your questions in, and you can do that at any point during the session. So please, as you think of something, just pop it in there. Now, if you're not familiar with Cat Care for Life, then please do take some time after the webinar to check out the dedicated website, which offers a whole host of free resources for both veterinary professionals and pet owners alike. There is so much to help you in your day-to-day work in your clinics. I think my personal favourite is probably the blood pressure monitoring chart. It's a really nice one, but there's also so much more, like dental charts, behaviour questionnaires. There's a lovely what age is your cat poster, pain scoring charts, and the list goes on and on. So please do have a look. I've popped a link to the website in the resources section, so it's just a quick click through there later on as well. So please do, and so it's all free, and it will be an absolutely fantastic resource for you to use in practice, and also to share with your clients, because there's a lot of information there which is really useful for people caring for cats as well. So Cat Care for Life is sponsored by Royal Canin, IDEX and Boehringer Ingelheim, so I just want to take this opportunity to, of course, thank them for their sponsorship, because that's allowing us to make this webinar free to everyone tonight as well. So a big thank you to them. Now, whilst I have you with me, I just really want to take a quick overview of ISFM membership, which is for vets and nurses, two categories. You can see the benefits now. I won't talk you through them, but you can see them there yourself. One of the big benefits of membership is webinars. So if you enjoy this webinar, then as a member you can access a whole load of exclusive member-only webinars which cover a huge range of topics, and we have absolutely fantastic speakers every month as well. So for that alone, it's worth it. And of course there's also a monthly journal as well. So again, at some point later on, please do pop over to the International Cat Care website, and you'll be able to find out more and hopefully sign up as well. So now to the star of the show, and of course the reason that you are with us today. I'm absolutely delighted to welcome Dr. Sarah Caney as our speaker. Now, I think Sarah probably doesn't really need a lot of introduction. I'm sure you're all very familiar with her work and her expertise in feline medicine. I do know that Sarah is particularly passionate about older cats. So it's, of course, absolutely brilliant for her to be with us tonight, to be able to talk about how we can help older cats from a clinical point of view, but also things that owners can do at home to help them as well. So without further ado, over to Sarah.
Hello, and thank you so much for choosing to listen to this webinar. In today's webinar, I'm going to be talking about preventative healthcare and early disease detection in elderly cats. My name is Sarah Caney. I'm a UK-based specialist in feline medicine, and I would love for you to visit my website, vetprofessionals.com, where you can find a lot of free-to-access information and resources, some of which are aimed at the pet owner, some of which is aimed at the veterinary professional, and much of which is orientated towards care of elderly cats. Before I go any further, I just want to define some of the terms that will be used in this session. Preventative healthcare is one of them, and the definition I've put on this slide is one that I found online, and as you can see relates to people rather than cats, but I think very nicely summarises what we mean by this term, which is taking measures that hopefully prevent disease and also allow us to diagnose disease before that illness has become perhaps serious, untreatable. The term here is catastrophic. The goal of all of our measures in preventative care are to help our patients to stay healthy, help them stay away from us. And a good example of preventative healthcare in the UK certainly is bowel cancer screening. And in the UK, depending on where you live, you will, following a certain landmark birthday. In Scotland, it's when you're 50. In England, it's when you're 60. I'm not sure about Wales and Northern Ireland. But following those milestone birthdays, you will receive a letter from your health service inviting you to send them a sample of your faeces for occult blood testing as part of screening for bowel cancer. And the reason I'm mentioning this is partly because this is something we will all experience at some point in our lives. So it's a good example of something that doesn't relate to our gender, but we know that as part of our life stage healthcare, we will experience at some point in our life. And it also helps me, certainly I think, working in Scotland, to know that when I see clients that I'm guesstimating are aged over 50, I know that they too have experienced life stage appropriate care. So when I talk about life stage appropriate care in their cat, hopefully it makes sense to them because they've already experienced it themselves. Early disease detection is the other term that was in the title, and what I mean by this is detection of disease before onset of clinical signs. It does also include those situations though where when we take a history, we can see that there have been actually clinical signs evident at home. Perhaps this is a cat that the owner, on questioning, realises is perhaps drinking a little bit more or is moving with a more stiff gait. But perhaps they've not thought that those changes were significant, or they've not been concerned sufficiently to bring the cat to see us. So whilst this may be detected in a routine appointment, it certainly is something that we would want to find, and is again a good example of how we might make an earlier disease diagnosis. And of course, the aim of our early diagnosis is to improve our treatment outcome. And we know that certain conditions can be cured. So for example, dental disease, hypothyroidism, potentially curable conditions. Other diseases are not curable, but we can perhaps slow the progression. A good example would be chronic kidney disease. And other conditions still, we may not be able to slow the progression, or we may not be able to cure them, but we can improve quality of life, and an example there might be a cat with osteoarthritis. So there's a lot we can do. There's a lot of, I think, good news in these diagnoses, and that's something that we should reassure our carers about. We're not doing these tests really for scientific curiosity. We're doing them because we know that there are quite likely to be things that we can do that can improve the quality of that cat's life, perhaps even improve the length of their life. And many carers, I think, really enjoy being involved more closely in the care of their cats, and particularly older cats. They're very special members of the home. They've obviously been with the carer through lots of ups and downs in their life, and therefore I think it's often really important that we provide this high level care for them too. This is a screenshot from a paper which was published a few years ago now, and was, I thought, a really brilliant paper in a number of ways. It reports some data from a total of 569 cats that were diagnosed with chronic kidney disease. And there were a number of really key findings which I found exciting. The first one was how useful it was looking at body weight in diagnosis of disease. And what the researchers found in this study was that weight loss was very common preceding the diagnosis. But in fact, for many of the cats, actually, if you looked back retrospectively through the records, they had been losing weight for several years. And perhaps because other clinical signs weren't present, further diagnostics had not been done until a later stage. So just looking at body weight, incredibly helpful in terms of identifying all sorts of illnesses, including CKD. But another finding from this paper was that actually the outcome was influenced by the cat's body weight at the time of diagnosis, in that cats that weighed less than 4.2 kilos at the time of their diagnosis had a significantly shorter survival time compared to the cats weighing 4.2 kilos or greater. And that perhaps tells us, it's maybe a little bit of a stretch, but perhaps tells us that actually early diagnosis when our cats are in better condition hopefully might result in a better outcome. So how can we do good preventative healthcare in our elderly cats? Well, I think a big part of that answer is to, where possible, embrace life stage appropriate veterinary care. And what that means is seeing our older cats in a slightly different way, perhaps, as I'll show you in a moment, seeing them more frequently, but also perhaps doing a more detailed assessment, a slightly different assessment according to the cat's age, so that we're really fine-tuning our skills to detect these common health problems at the earliest possible opportunity. That, of course, needs us to keep in close contact with the carer, and often a lot of education is important, I think, in the earlier stages of life to really make sure that we have that good bond with them. And there are lots and lots of challenges, but where we can, keep that close contact, keep that good team relationship with the carer and embrace the life stage appropriate care, then I think that's going to result in the best outcome. And the life stage appropriate care that I would recommend are the iCat Care guidelines, what are called the Cat Care for Life guidelines now. And before we talk about what those guidelines include, it's worth defining more clearly the different life stages of cats, because if we want to do life stage appropriate care, we need to know what the life stages are and what age of cat corresponds to each of these. And this is a really lovely poster which you can download for free from the iCat Care website. You may even be able to get a print copy for your clinic. And as you can see, it has the different life stages of cat on the left, from the kitten through to the last category, which is this fabulously renamed super senior category. It was originally the geriatric category, cats aged 15 years and over, but now iCat Care, I think absolutely brilliantly, have renamed this the super senior, so it's like the superhero status cat at the bottom of the chart. And then we've got in that first column age of cat that corresponds to each of these life stages. And then also, I think brilliantly, a human equivalent age in that right-hand column. And this also I find incredibly helpful. So for a start, you can see that a senior cat, an 11-year-old cat, is thought to be equivalent to a 60-year-old person. And so if you're working in England, talking to your clients about health screening of an 11-year-old cat, it is analogous in some ways to that 60-year-old person who's just going to get their first letter from the NHS about bowel cancer screening. And therefore, again, hopefully it just puts this in a language which our clients can really relate to and embrace. And from an elderly cat perspective, the key stages where we want to be very much on the lookout for these common health problems and probably actively diagnosing them as the cat moves through the later stages of these are, of course, our mature, senior and super senior categories. So the cats aged 7 years and up. We're going to have the highest diagnostic yield in the super seniors quite clearly, but quite a few senior cats are likely to be affected by these common cat illnesses. The mature category, the 7 to 10-year-olds, much less so, but it's a good time point to re-engage that communication with the client, educate them as to why we're going to be doing this, how treatable all these problems are. The vet clinic should be the first place you speak to if you have any concerns about your cat. So what do the iCat Care guidelines recommend? Well, firstly, they have a website dedicated to these guidelines, which is their catcare.co.uk. 4life.org, as written at the top of this slide. And what they recommend is that for cats aged up to 7 years, we do what is, I think, probably quite normal practice in our clinics, which is we try and see our patients once a year to do a thorough history, physical examination and body weight check. But that once the cat reaches the age of 7, this mature age category, that we, where possible, are more detailed in our assessment. So where at all possible, as well as doing that annual health check as described, we would include a blood pressure assessment, urinalysis and blood profiles. And that urinalysis can be from a free catch sample. Many cat owners, in my experience, are very good at bringing in urine samples from their cats, so it can be tested at the time of the appointment, which is an advantage in terms of time and logistics. I'll talk more about the blood profiles and what I would suggest are included in those a little bit later. Once the cat reaches the senior age category, so this is cats aged 11 to 14 years now, where possible, see the cat every 6 months rather than every 12 months. Again, the most important thing really in terms of the checkup is still the history, physical exam and weight check, but blood pressure, urinalysis, blood work where possible, I would say on a 6 to 12 monthly basis in these cats, 12 monthly an ideal minimum, 6 monthly if you feel there is a change or if you notice a change in the cat, of course, or if there's any concerns. And also where possible include a T4 in your profile at this point, because hypothyroidism we know becomes more likely in cats of this age group. And then the last category is the super senior, and my understanding certainly is that from iCatCare's guidelines that the recommendations for the super seniors are very much the same as the seniors, perhaps more of an emphasis on the 6 monthly check if possible. But as you can see, I've put on this slide here that actually I think there is good rationale, particularly in your really elderly cats, to see them every 3 months. And that could be a nurse appointment, again, doing a really thorough history, physical exam, weight check, really discussing common issues, providing support for common issues as well. And that, I think, will be of benefit to many very old cats. So there's a lot here, and I know that it's a challenge to achieve this, and compliance from our clients to also sign up for this can be a challenge as well. But I think that these are very sensible guidelines in the sense that the 7 to 10-year-old, that cat is unlikely to have massively significant health problems, more likely to have obesity and dental disease than hypothyroidism and kidney disease. However, it's a good time point to re-engage, reconnect with the client and discuss and educate them about elderly cat care to get some nice baseline test results as well. The highest diagnostic yield, of course, is going to be in those super senior cats. Even if we are offering these checks as part of perhaps a care plan, which our client is already paying for, that covers their vaccinations, flea, worm treatment and so on, I think we often still need to sell it as a concept to our client, because we need to passionately communicate to our carers that this is something we think is important. Otherwise, why are they going to bring their cat in for this check and allow us to stick a needle into the cat to collect a blood sample? We need to really tell them why we passionately believe this is so important. And part of that, I think, is telling people how common some of these old cat illnesses are. And for example, we know chronic kidney disease is really common in old cats, perhaps affecting more than a third of our senior cats and maybe a greater proportion of our super senior cats. Hypothyroidism, estimated to affect about 10% of senior cats, so that's a significant number. Diabetes mellitus, a lower prevalence, it's less common than hypothyroidism, but because many owners will be aware of it, it's probably not a bad example of something to talk about, because they will have their own experience of this condition as well. And then we have other conditions. Systemic hypertension probably affects about 20% of older cats, but we know in particular that it can be seen in association with certain illnesses, chronic kidney disease being the absolute classic, where some studies have shown up to 60 or 65% of cats with kidney disease develop hypertension. Then we have osteoarthritis, which we know also is very common and radiographically estimated to affect more than 90% of senior cats. And whilst not all of those cats will be in severe chronic pain, maybe half of them will have significant pain in association with that. And then lastly, we have cognitive dysfunction syndrome, the cause of feline dementia, which is also very common, affecting more than a quarter of our senior cats and more than half of super senior cats. So really, if you have a cat that lives to be in the senior or super senior age category, it's highly likely to have one or more of these issues. And there are positive things we can do to help all of the issues that I've listed on this slide. So we need to make the most of any opportunity when we're seeing our senior and super senior cats to do a thorough assessment. The history really is the same as usual in that we just need to be thorough and ask all those usual questions about appetite, thirst, weight, toileting behaviour, etc. But I think it is a good point to remind us that in the older cats in particular, we do want to bring up behaviour, we do want to bring up toileting accidents, because those are things that are not always brought up voluntarily by our clients, but can give us clues of conditions like hypothyroidism, hypertension, cognitive dysfunction, for example. And the other main area that is, I think, really important to bring up at that older cat consultation is mobility, the cat's ability to move around, and whether they are showing any signs of mobility problems. Also included on this slide, visual deficits, and I do think that's something worth bringing up with clients, because it allows us that opportunity to talk a little bit about systemic hypertension, which of course is a very serious, potentially life-threatening killer of cats, but also very treatable. And so telling a client that, you know, if they see any visual deficits or apparent blindness in their cat, that should be viewed as an emergency so that we can hopefully diagnose and treat it as quickly as possible. There's a lot to remember, and as I get older, I often need lists, and checklists really help me. So I have got a questionnaire which is free to download from my website. If you go to the main homepage of vetprofessionals.com, one of the menus is helpful info, and this senior cat health questionnaire is in the free download section, which you do need to register to access, but we will very much treat your data in a GDPR compliant way. We will not send you any newsletters if you do not want to ever hear from us, and it is free to register. And you can download the senior cat questionnaire, and what you will see if you do so is that there is a section early on which asks lots of history questions that are general health history questions. So have you noticed any change in your cat's ... and then thirst, appetite, etc. on there. And then the next section, which is on the right hand side of this slide, is a mobility questionnaire, and the questions here are really questions orientated towards understanding changes in the cat's behaviour or lifestyle which may have resulted from chronic pain. And so they include, for example, have there been any changes in the cat's ability or enthusiasm to do certain things like go up and down the stairs, use the cat flap, jump onto the bed. Also, have you noticed any signs of pain, stiff or stilted gait, a limp, vocalising when stroked over joints? Has your cat's behaviour changed? Is it more grumpy or more withdrawn? So lots and lots of questions, and I think the usefulness of these questions is actually twofold. Part one is actually, of course, if you find you get the answer yes to any of these, as in there has been a change, it gives you something very definite to follow up. But also for the people that say no, it's been useful because they now know what to look out for in their cat. And often what I find is that the first time I ask a carer these questions, and often this is something I run through in the consulting room, they will often say, oh no, everything's fine. My cat just loves sitting on the windowsill in the kitchen, you know, loves watching the world go by, no problem at all getting up there. And then they will go home and they will look at the cat more closely, and they might come back to me the next time saying, actually, I've spotted my cat is only now going up to that kitchen windowsill if I leave a chair by the window, and they're jumping on the chair first and then the windowsill, and if I don't leave the chair there, they don't go on the windowsill anymore. So I've now in a way trained these owners what to look out for, and I do find that really helpful, and again it brings them into the discussions. The clinic that I'm currently working with most closely is one called Ingalls in Scotland, and they did something very, very innovative with their cat consulting rooms, actually before I joined the clinic, so I take no credit for this whatsoever. But next to the work surface where the cat scales were, they decided to build some steps into the side of the wall to see if it would be possible to persuade the cat to go up or down the steps, and therefore allow some sort of mobility assessment within the consulting room. And what we found was that actually the cats, the older cats in particular, after being weighed, often will just voluntarily choose to come down those steps. And so we can get some information about their mobility, but again, I think more importantly, it's actually a discussion point with the carers, so that we're explaining, well, what are we looking out for? Why are we doing this? Why is arthritis important to know about in our older cats? So whilst certainly not orthopedically perfect, it does give us an ability to have a look at our patients and get a little bit of information about their mobility. And yes, the videos always play a little bit jerkily, I'm afraid, when doing a recording, but this is Malcolm coming down with a little bit of hesitation, but really not too bad. This next example is actually a cat with very severe mobility problems, and again may not record too smoothly, but what you will see quite clearly is that whilst she is enthusiastic to attempt to come down the steps, she then gets to a certain point where she decides, actually, I'm not going to do this anymore. It's too sore. It's too difficult. So I have found these a useful addition to the consulting room, and a little bit of extra seating available for those times when clients are once again hopefully allowed into our consulting rooms. So what should our examination protocol, if you like, be for our elderly cats? Well, where possible, certainly if the cat is happy to come out of their carrier and they're moving around the consulting room whilst we're perhaps chatting to the owner and taking a history, again in normal times, not COVID times, we might get a little bit of opportunity to assess gait in that way. But the first hands-on thing we do should be blood pressure assessment. Ideally after a period of acclimatisation, let the cat have at least 5, if not 10 minutes to settle into the room before we take measurements, so that hopefully we minimise the stress impact on blood pressure readings. And then the rest of the physical examination, thorough as always, but extra little things would include making sure we do feel for a goiter, because hypothyroidism often is associated with a goiter. So 80 or 90% of cats with hypothyroidism will have a palpable thyroid. Healthy cats should not have a palpable thyroid, so that would be certainly a helpful thing to look out for. Also in these cats with hypothyroidism, as you'll know, often we have a tachycardia and a heart murmur on cardiac auscultation. Eye examination is on the list from a hypertension perspective, and of course weighing our patients' body condition, muscle condition, scoring them. So we've got the usual list, but I think some extra little emphasis in the older cat, blood pressure being one of these. So where at all possible, assess blood pressure as part of that senior cat health assessment. And if you're very short of time and clinic life can be extremely busy, then I would encourage you to, as a minimum, look at the cat's eyes. And as long as you have a room that can be made dark, a room that doesn't have windows or that has blackout blinds, you can turn out the lights, have a quick look at the back of the eye using this technique, which I'm demonstrating in this picture. Obviously you would do it in the dark, but you can't see what I'm doing if it's taken in the dark. But this is distant indirect ophthalmoscopy, where we use a hand lens and a light source, and that's often a very quick and easy way to see the back of the eye of a cat. And if you do see that there is hemorrhage or detachment, you know this cat really does need a blood pressure assessment. But if the eyes look quite normal, then if you are really stretched for time that day, hopefully you can timetable a blood pressure assessment on another occasion. And many owners, in my experience, are quite comfortable with coming back for another assessment if we feel it is appropriate and important for their cat. Weight check, well, I think all clinics now are really good at having scales in the room, which really means there's no excuse not to weigh the patient every time we see it, but also good practice to assess body condition score, potentially look at percentage weight changes, as I'll talk about in just a moment. When is weight loss significant? Well, whenever you can see a downward trend in weight, even if that downward trend is very, very gentle, if it's unintended, then it's likely to be significant from the cat's perspective. Also, definite cause for concern would be when muscle condition is lost, because we know how difficult it is to get muscle mass back on a cat once it has been lost. So ideally we have records like Cherubs on the right, where we've just got a gazillion weight records over the years, all the ups and downs, very nicely and helpfully logged, versus Jasper on the left, who came in with a history of weight loss, and we just had one reading on the computer. And in fact, there was a very sensible and logical reason for this, which was that Jasper's owner is actually a veterinary professional, and we are not always as good at recording data as we should be, particularly when it comes to our own pets. And I will confess that my own pets' records, when I have had a responsibility for them, have also, sometimes not quite met the standards I would like to set for my other patients. So where possible, weigh our patients every time we see them, when they're healthy as well as when they're ill, get good data on their weight, so we know then when our cat's unwell what might be significant. If you don't have very many measurements, so for cats like Jasper, if we didn't have previous weight data, we just have one weight record, it can be quite useful to calculate percentage weight changes. So you need obviously two readings to do this. You need a last time's reading and today's reading. And to calculate percentage weight change, you calculate the difference between those two readings, so today compared to last time, divided by the original weight, and then multiplied by 100%. So for a 4 kilo cat, if they weighed then 3.8 kilos at their next check, that's 200 grams of loss, which is 5% weight loss. And in terms of judging the significance of weight loss, I use the criteria as presented on this slide. So less than 5% weight loss is difficult to determine the significance. If concerned, definitely reweigh the cat. But if your cat has lost 5% or more of their body weight, then that, in my view, is significant. So if, for example, this is a cat that a year ago weighed 4 kilos and now weighs 3.8 or less, then in my view that is significant for that cat. I judge that also on the basis that if you turned those numbers into sort of human numbers, perhaps someone who weighed about 10 stone, about 65 kilos, 5% weight loss is half a stone, it's 3.2 kilos. Our weight does not fluctuate that much day to day. Therefore, when we have lost half a stone, it's either because we're really trying to lose weight or because we're ill. And I think the same applies to cats. This is really based on my experience and on owner monitoring of their cats at home that I have devised these sorts of guidelines for my cases. This is the end of the questionnaire that I mentioned you, so just a reminder of things to do in our examination and space to record it. So for example, what's the blood pressure, what's the body weight, are there other abnormalities? So now we've done a history, we've done a physical examination. In a perfect world, our owner comes in with a urine sample that we can test. Otherwise, collecting a urine sample is an advantage, so we can look at that. And the key things really we want to look at are specific gravity primarily, to a secondary extent the dipstick. And the main utility of the dipstick is actually glucose in terms of cats that we suspect of diabetes. We know that dipsticks have lots of things that they are quite unreliable for, so definitely don't want to trust them for things like specific gravity, for example. And in terms of how we interpret our urine-specific gravity results, I would consider a USG greater than 1040 to be absolutely normal, good evidence of renal concentrating. If everything else is okay in my cat, then no further action is needed. But conversely, if we have a USG less than 1035, unless there is a really good physiological or iatrogenic reason for that. For example, the cat is receiving diuretics because it has cardiac disease, or it's a cat that's fed a liquid diet because perhaps it had an esophageal problem when it was younger. If there's nothing like that, then a USG less than 1035, in my opinion, is typically abnormal for a cat and most frequently associated with illnesses such as chronic kidney disease, hypothyroidism, diabetes mellitus, or a combination of those, and very much on its own, I think, justification for doing further tests. I also have a little bit of a grey zone, this 1035 to 1040, where this would be the zone where I would just want to look at the cat a little bit more carefully. If everything seems fine today, well, that's okay, but I'm probably not going to want to leave it a year before I see you again. I might want to see you in 3 to 6 months, just to really keep a closer eye on things. From a blood test perspective, ideally, it's of course going to be to include a broad profile so that we look at as many things as are sensible to look at when we're doing our preventative health care. So ideally would be some sort of wellness profile that includes haematology, also biochemistry, and where possible, particularly for the seniors and super seniors, a total T4. If doing that combination is not possible for whatever reason, then probably what you would offer as a pre-anaesthetic screen is going to be a very good start. So even if that's just a PCV for haematology, liver enzymes, urea, creatinine and proteins on your biochemistry, ideally do a glucometer in the consulting room to just add that to the mix. And if you see, for example, an increase in liver enzymes, then a good next step would be to check the T4. Urine, as we've mentioned, it's specific gravity and dipstick primarily, so free catch sample, absolutely fine for that. So why are we doing this again? Well, it's really finding things that we can help. So lots of older cats have clinical and subclinical problems that can be identified through this thorough approach, and we can help. We can potentially cure, we can potentially slow progression, we can potentially improve quality of life, or do all three of those in the same situation. And hopefully earlier intervention leads to a better treatment outcome, with examples of things like systemic hypertension being good ones, because clearly if we can identify significant systemic hypertension before a cat has developed ocular manifestations of that, then we can actually maintain vision and prevent blindness in them. But overall, I do think as well that this aspect of work can be incredibly rewarding, both to ourselves as clinicians, but also to carers as well. We can really feel like we're making a positive difference to the cats. And in justifying it to the carers, well, these are some of the things that I would really talk about with my owners. So, for example, we do know as clinicians, cats are really good at hiding illness. If they feel in any pain, they will adjust their lifestyle, they will adjust their activity levels to cope with that, to compensate for that. So, for example, the cat with crippling osteoarthritis can be quite hard to spot at home because a cat sleeping on a bed on the floor, for example, can be just interpreted as a normal cat. Oh, it loves sleeping on that mat, it sleeps on that mat all day, rather than, oh, perhaps it's not sleeping on the bed anymore because it can't get there. Often, as well as we know, clinical signs develop very insidiously, very gradually progressive. So all of the conditions like hypothyroidism, chronic kidney disease, these common old cat conditions, they do develop quite slowly. It's very hard to spot weight loss in your cat when you live with it at home. And so therefore, again, these preventative healthcare checks are really helpful for identifying problems and also reassuring owners as to what they should expect for the quality of life of their elderly cat. It's not normal and to be expected for that old cat to be skinny, to be in pain, to be in discomfort with a poor coat. There's a lot we can do to help them. So how effective do I think this early disease screening is? Well, I can tell you some of my own direct experience of this, and this is actually a study I was involved with. A colleague of mine, Natasha Mitchell, who's a veterinary ophthalmologist, wanted to look at ocular manifestations of diabetes in cats. This was quite a long time ago now, I think about 15 years we did this study, and we found 21 diabetic cats in the practice, and then we found some age-matched control cats because we wanted to make sure or Natasha wanted to make sure that any abnormalities she saw in the diabetic cats were not just age-related changes. So we got some age-matched control cats that of course were not diabetic. They actually were pretty much all senior and super senior in age, and they were defined as being control cats for this study by virtue of the fact that they were not thought by either us or the owner to have any significant illness. They weren't on any medication. So from our perspective at the clinic, these were all cats that had been into the clinic within the previous year. They were healthy cats to look at. And of course, I wouldn't be talking about them if they were completely healthy. What we found when we did our detailed assessment was that from a urine-specific gravity perspective, a third of the cats had abnormal urine-specific gravity, a third were borderline, and a third were normal. Blood pressure was significantly elevated, systemic hypertension confirmed in 14% of our control population. And on our blood tests, we found 10% of our control cats were hypothyroid, and about a third of our cats had chronic kidney disease. Most of those cats were in IRIS stage 2, but one of the cats, as you can see, was in IRIS stage 3, creatinine 283. And yet all of these cats were thought by us on the clinic records and by their owners to be completely healthy. So this perhaps is an indication of what we might see in our healthy cats if we're able to do the sort of health screening that we would want to do. Also of interest and included here is the fact that the diabetic cats, we did all the same tests with them as well, of course, and we did find that 3 of the diabetic cats had hypothyroidism, and they'd all actually had a T4 test at the time their diabetes was diagnosed, but this is just going to show that things do change with time. And whilst 2 of the cats, as you can see, the elevation in T4 is quite mild. One of the cats had a T4 over 200, very definitely expected to be associated with clinical consequences. With Ingalls, I've been working over recent years to try and help them set up senior clinics, and they've been doing a great job of marketing these clinics to their clients. And the shared experience from this has been, firstly, with your mature cats, the 7 to 10-year-olds, it's quite hard work getting carers to come in for these appointments, even if they are free to them or no extra charge because they're part of their care plan. So maybe 10% of those invited with repeat and different modalities of invitations have attended the senior checks. The people that have come in absolutely love those checks, and actually about a fifth of the cats have needed to be referred on for veterinary treatment. These are nurse-led clinics, and the sorts of treatments that they've needed, dental treatment, obesity management, most commonly. For the senior cats, a higher level of uptake, possibly because some of these owners do have some slight niggling concerns, and this is a good opportunity to explore that and discuss that with a nurse. And probably about a third of these cats that have come in have been referred on for further investigation or with a diagnosis. So again, dental disease is in there, but also now kidney disease, thyroid disease, hypertension and so on. And for the super senior cats, probably more than half of those cats have had identifiable significant problems warranting further treatment or advice. There are some publications that also give us an indication of how likely it is we are to find problems in our patients coming in for these more routine checks. This is quite an old paper, 1998, looks at cats and dogs coming in for vaccination and includes actually cats and dogs of all ages, so 0 to 5 years, 5 to 10 years, and then more than 10 years old. And you can see that actually a huge proportion of patients in every age group at pretty much every time point that have intercurrent disease. And I think the nature of that intercurrent disease of course varies according to the age of the animal, but you can see again that there is justification for these checks, and perhaps we should not be calling them booster appointments, but actually they should be just a healthcare appointment at which perhaps a booster is required, but there are bigger issues on the table beyond that. This is a more recent example of a study of 100 healthy cats. About half of them were senior and super senior. The other half were middle-aged cats, more that mature age category. And again, quite a significant number of cats where problems were found. You can see that weight abnormalities actually in about half of the cats, 40 of the cats too fat, 11 of them were too thin and had further diagnostics done and identifiable illnesses. Again, overall, a significant but small number of them had high blood pressure. 8% of the cats, about 10% of the cats had heart murmurs. 20 of the cats had goiters. 15 of the cats had reduced urine-specific gravity. So quite a high yield of abnormalities in these cats, and perhaps more in the older cats and younger cats in terms of the sort of changes I've been talking about. But the young cats still, quite a lot of concurrent issues benefiting from management. Another last two things to finish with. So this is again even more slightly up to date for us. Not really old cats, cats aged 6 to 9, but assessed in detail. And again, this statement here of how common it was to find problems. Of the 130 cats, only 26 had no abnormalities. And whilst many changes were minor, changes diagnostic of significant disease were identified in 25 cats, which was 20% of the cats overall, so a fifth of the cats overall. And then lastly, on a slight tangent, but I think a related tangent, some research on owner expectations of preventative healthcare appointments. The owners do like this. They like the opportunity to discuss a range of things, and they like a checklist approach, and actually telling your owners what you're doing and what you've checked for, I think again really helps them to understand the importance of the appointment and what they have achieved with their cat through that appointment as well. As I've already said, it can be quite hard persuading carers to come in for that appointment, and stress associated with a visit to the vet is certainly a big deal. It can really put carers off bringing their cats in for visits, particularly for visits that they might feel are non-essential. So vaccination appointments, preventative healthcare appointments, compared to obviously a cat that is ill. And there are lots of concerns that owners quite understandably have as well with, are these interventions going to benefit my cat? Are they going to be painful? Are they going to be expensive? Might you be recommending I put my cat to sleep? So there's a lot we need to do to, I think, educate our carers, perhaps through case studies, client evenings, all these sorts of things, just to really make it normal. That this is a care plan that we follow in our practice. We believe it's the right thing to do for our patients, to follow these guidelines, and we believe that this is the best way of supporting your cat as they get older. So I hope that I've sort of enthused you a little bit as to why I passionately believe this is important. I do recognise it is really challenging to do in the practice, particularly if you're thinking of all the cats that you see at the moment that are age 7 and over. That's a lot of cats that potentially you might be recommending now blood pressure, urinalysis, blood tests, etc. And also that there are cost implications to our clients as well. If you do have a care plan that you can build in these sort of costs, then I think that can help, because it spreads the costs and bonds our clients in a different way. But also just consider the practicalities and a pragmatic approach for your clinic as well. So you may just be too space constrained or staff constrained to do everything, in which case you may want to focus on those super senior cats in particular, the senior cats where possible, and perhaps leave the mature cats out of it for now. Or you could do drives for urinalysis screening with owners collecting the samples at home. So that takes a lot of the burden away from you in terms of time to collect a sample, but you have that diagnostic sample that you can assess, interpret and take further steps with. Other options for client education would include open days or evenings, which of course currently would have to be on Zoom or similar, but everyone now is used to Zoom, so maybe that's a nice social way to talk to your clients and have some discussion on these sorts of things. Questionnaires can definitely help. Ingalls have sent a very condensed form of the health questionnaire out also to clients as a prompt for we're offering this senior check, and if you tick yes to anything on this list, please take up our invitation, or if you would prefer, we can phone you and discuss things. So there's an option really for a nurse to call back. And that has helped to, I think, increase uptake of this sort of service. You do need time to do all these things as well, and I think that really should be valued and recognised as important time within the clinic. It can take 20 or 30 minutes to do everything you might want to do for your senior cat appointment, or indeed, depending on the way your clinic works, it might work better to actually have the patient admitted for those sorts of assessments, do the history over the phone or over Zoom, and then let's say admit the cat for a few hours, and then we can just take it slowly, do the blood pressure, then do the blood tests and the urinalysis over a period of a few hours, so it's perhaps less intense for the cat. I do think as well that, and COVID has of course forced this on us in many ways, but there is a lot to be gained from speaking to people over the phone. Just a plain old phone often works well. We can focus on what we're talking about, collect a lot of useful data, encourage clients to consider that a valid way of communicating with us. And as a proper appointment, I'm not suggesting that this is, a free of charge discussion with our clients, but that it can be a very effective way of really unpicking client concerns, client worries, and also, of course, from a diagnosis and treatment perspective, supporting the diagnostic recommendations, supporting concordance or achieving concordance, and then good compliance to our treatment plan. And using your vet nurses to really support all these initiatives as well, I think is absolutely key. So there's a lot to do, and a lot that's still a long way still to go in many ways. But I do think preventative healthcare is very much on the map. It's on the agenda. It is happening in many of your clinics, and well done to all of you that are managing to do even some of this. You're doing a brilliant job, and I know from the owner surveys I do that it has resulted in diagnoses being made at an earlier stage, which is ultimately what that's all about. So I will conclude now just by showing you a screenshot of my website. That helpful info menu is the one I mentioned. The free downloads are the sort of technical guides in PDF form, but they're also the video tutorial page is another page that you might find helpful. I've been running some cat cafes for owners of cats and doing educational sessions, and the webinar component of those cat cafes are all up free to view and cover all sorts of topics, including lots and lots about elderly cats. And I've also run a similar initiative for vets and vet nurses called my 10-minute tips, which tend to be more like 15 minutes, I'm afraid. But these two are free to access. There's tips on things like blood pressure assessment, urine sample collection, feeding tube placement, all sorts of things. So please do have a look, gather whatever information that you think is helpful. Feel free to provide me with some feedback. And if I can't answer all the questions that you might have today, or if you're listening to this on demand, then you are welcome to send me an email, and I will do my best to reply to you in a timely fashion. Thank you so much for listening. I hope this has been a helpful experience for you. Thank you very much.
Absolutely amazing. Thank you so much, Sarah, for a really interesting and engaging presentation, but also lots of top tips for both us in the clinic, but also to share with our cat owners as well. So absolutely brilliant. And we've had a lot of questions come through. So are you okay to go through a few now?
Go for it. Yes, I'm
going to pick a few of the ones that were where there was a few questions around the same theme, and hopefully we'll cover them. I'm just seeing lots of thank yous coming in now, so people have really enjoyed it. But I think we could just a few bits. I'll just try and do it in kind of the order of the webinar as well. So when you were talking about osteoarthritis in cats, someone asked, would it be useful for owners to do videos before them and either send them or bring them into you? So do you think the use of videos is something that, particularly for arthritis, but maybe other things as well, is something that could be useful for us?
Yes, yeah, I do. I think, and I have talked about this certainly with some of my clients, and of course, it can be a challenge filming your animal at home as a carer and as an owner, as someone who's videoed my own cats as well. And I probably should think a little bit more about maybe writing some guidelines from what I have learned so far as to what might be useful tips. But yes, I do think that's a good idea. For example, if they're able to get a video of cat going up and down steps at home or jumping on or off things, as well as moving around in general, then I think that can be helpful. Obviously, there are limitations, and with cats, generally, we're not going to be able to train them to perhaps, trot up and down in the way that a dog might. But no, I do think that there can be a lot of value, and the mobility part of any consultation is often quite challenged in the clinic by obviously stress in the cat and the clinic setup. So getting some home footage, I think, can help overcome some of those challenges.
Brilliant, excellent. And nowadays, with a lot of people having smartphones, it's obviously much easier than it used to be, where you had to get a big video camera out to do this kind of thing. So technology has really helped us with that as well, hasn't it?
Yes, absolutely. And I think in terms of sharing, that can be a little bit of a challenge. But the easiest way I find generally is if you can just share by WhatsApp. And so maybe the clinic actually gets a mobile that has a WhatsApp account for that sort of thing, so that you're not sharing your personal contact details with your clients, although I have, like many of you. But for sharing videos, that can be the only challenge. If they have to then sort of somehow get it onto their computer and somehow use a file sharing thing, it's more of a hassle, whereas WhatsApp is, really brilliant at that sort of thing.
Excellent. Thank you. Right. Okay, let's have a quick look. So there are a few questions about weighing cats, and particularly about cat owners weighing their cats at home. So do you feel that's a good thing for people to do at home? And if so, do you have any recommendations on how often they would do that, or the type of scales? Obviously, sort of the scales that are intended for us people are maybe not the best ones to use. So do you have any tips around that side of things?
Yes, I do. I'm happy to share what I've learned again. I do encourage this actually in my clients, not as a routine thing, although I think you absolutely could with your very keen cat owners. We've recently acquired some kittens at home, so I have got some scales at home and been weighing them most weeks to just, see how things are developing. And you can get some, I think, very inexpensive and I think still fairly reliable scales from comparing the at-home measurements to in-clinic measurements in my own cats. eBay, for example, the cheapest one's probably around about £20, maybe slightly less than that. The cheap ones are still, if you search for cat scales, you will find them, but they probably originally were designed for babies. So if you search for baby scales, you will also find lots of these scales. And the very cheapest ones have the option of on-off kilograms and pounds, and that's pretty much it. And they will typically stay on for a few seconds and then they'll go off. So if you have a very fidgety cat that is sort of wobbling around on the scales, you do have to be observing them to find their weight. If you want a hold feature, which obviously many of the scales in your clinics will have, they tend to be more expensive. Off the top of my head, I think they're more like £40 to £60 in my investigations, but they can still be helpful for those wriggly cats, and it's not a huge expense for your very keen and committed clients. And in terms of frequency, I think really it depends on the cat, their age, and obviously their health. So, for example, a completely healthy cat, then, generally you're probably, I would say every 6 months is probably adequate. Maybe every 3 months if you really want to be a keen owner. But the sort of similar frequency that we would examine our cats in terms of routine health checks, which tend to be once or twice a year. For the older cats, though, and I would particularly say the senior and the super senior age categories, I do think actually a once a month weight check is perfectly sensible, and the advantage of it being once a month is that's fairly easy, I think, as a client to remember or mark on their calendar, or if they miss a month, at least they know that rough frequency. And as I think I mentioned in the webinar, really, if they can see that there is a repeated reduction in weight, or indeed a repeated increase in weight, in thinking of the obesity issue, then that's really when I think it should prompt them to think, do I need some advice, and to contact us really for further advice and support. Particularly obviously with the older cats, it's often weight loss, and typically it is quite gradual. That big series of cats with kidney disease, for them, they typically were losing weight for 2 or 3 years before it was diagnosed, and not that they were being ignored by their vets or their owners, but just it reflects, I think, the fact that often this weight loss is gradual, and particularly if the cat has been overweight in the past, it's maybe a bit easier to say, oh, look, they've lost a little bit of weight, well done. But we don't really lose weight without effort, sadly. And so I think whenever there is a persistent change in whatever direction, it should make us sort of sit up and think a little bit. And I guess, for cats with chronic illnesses as well, your thyroid and your kidney cats, then I often will say to owners maybe weigh once a week, particularly if they are in a sort of period of instability. If we're struggling a bit with appetite and eating in a cat with kidney disease, then I often will say to the clients, weigh them every week. If they were a particularly fragile cat, and particularly at the moment trying to minimise visits to the vet, you could justify more often than that. For example, a cat with CKD that was receiving fluids at home to support its hydration, maybe a daily weight record even would be something that could help. And indeed, a lot of my owners, when I've said to them weigh once a week, they have actually done weigh every day. Some of them weigh twice a day, and then I get these amazing sort of graphs and charts. But actually the data is still really helpful, and what you tend to see is with stable cats, whether they're healthy or have a chronic disease, if they're stable, their weight actually is remarkably similar from day to day and hour to hour. But if they are suffering problems, you do spot it. So whilst it might not reach those percentage triggers I talked about as being cause for concern on a daily basis, unless there's obviously significant dehydration, you're still going to see it, and therefore it is helpful.
Excellent. Thank you. That's really good, because there was lots of questions about that, and obviously a lot of clients want to do things at home, and getting a set of scales and weighing your cat is something that can often be done quite easily in the home. Not always.
Yes, absolutely. Yeah, and I think the sort of scales, even the really cheap ones I mentioned, which are what I have at home. We just put a few dreamies on the scales, then switch them on, plonk the cat on, and as they munch away, just get a weight measurement, and most cats will be comfortable with that. If you did have a particularly tricky cat, these scales actually are big enough to cope with a carrier, so you could, if you really needed to. I don't think there would be many situations where you'd have to do this, but you could put the carrier on the scales with the cat in it as well, and that would work fine.
Brilliant. Okay. Blood pressure. There's lots of people asking about blood pressure. It appears that not everyone is doing it as standard, so it was really nice to cover that as well. But any sort of top tips for removing the stress factor from blood pressure measurements in the clinic at all that you can?
Yeah, so that's just a day in itself of discussion.
Yes, exactly.
And those of you who've asked that question, yes, I think, it just shows also what brilliant clinicians you are, that you're thinking about this, because clearly this stress-associated increase in blood pressure, what we now are supposed to call situational hypertension. This is not real hypertension, but just in certain situations that the blood pressure is increased due to anxiety. It is a big deal. I think the answer to it, there's multiple answers, which include from the owner's perspective, having a carrier that is easy to get the cat in and out of, so it's not a sort of stress to actually get the cat in the carrier at the start of the journey, perhaps doing some carrier training. And iCat have got some lovely videos on this, actually, with Sarah Ellis training, I think, one of her cats, to be happy going into a cat carrier. And anything we can do to reduce the stress of the journey, so fell away, familiar bedding, covering the carrier so the cat can hide a little bit, minimizing the waiting period, minimizing exposure to other animals and people in the clinic. So if it is a really busy clinic where you've got a shared waiting room, then perhaps say to the client, wait in the car with your cat. And of course, particularly at the moment, things are very strange in terms of clients not going into practices. But even thinking beyond that, stay in the car with your cat, and once we're ready, we'll come and get you. And then again, within the clinic, different things can work well. So for some clinics, what works well is actually the cat coming in a little bit before their timed appointment, if you like, but they have some actual allocated time in a consulting room to just quietly, again, settle away from other cats, people, etc., to just sort of have a little bit of a catch your breath before things start. And then ideally, we should allow the cat 5 or 10 minutes to have that sort of period of acclimatization to the clinic, so that hopefully that big increase in blood pressure as the cat comes through the doors has a time to settle a little bit. And then with the cat itself, restraint, of course, the sort of minimum, and perhaps choosing according to the cat what it's most comfortable with in terms of the procedure. So some elderly cats with bad arthritis really don't like their paws being manipulated, or perhaps having to stand on one fewer legs is uncomfortable, so the tail can be helpful for those cats. And also for cats that get very anxious, gabapentin, which is something I'm sure many of you are using in this situation, can be really helpful. For those of you that are not using gabapentin, this is something that we all know as a neuropathic analgesic, so it's a painkiller, which is obviously not vet licensed, but when used for pain, for example osteoarthritis, typically the first few days of therapy the cats will be slightly sedated, and someone, not me sadly, but someone had a bright idea of exploiting that side effect, if you like, and using a higher dose of gabapentin as a one-off, which is given at home by the owner, typically a dose of about 20 milligrams per kilogram. So maybe a little cat would get 50 milligrams, a big cat 100 milligrams of gabapentin in a small amount of food or a treat, so a little bit of tuna or licky licks or whatever at home, 2 hours before they're due to go into their carrier. And most cats will just be, I would say to owners, a little bit zombified. They're conscious, they're not asleep, but they are a little bit vacant, and a bit slug-like as well, is another analogy I would use. And there's one study reporting its use, which is in JAVMA, some authors with quite difficult names to pronounce, but you will find it if you search for gabapentin vet visit. And they showed that it was very well tolerated and really did improve the cat's stress experience, as in reduce the stress, and it doesn't impact on things like blood pressure measurements. So it is really a good option for those cats that get very anxious, and they're going to, perhaps it's a cat with kidney disease or hypothyroidism that has to come in for these periodic assessments, and it's a bit of a stress. It can really be a real game changer in my experience. So that would be something else to think about.
Excellent. That's perfect, because we've also had a lot of people asking about sedation of cat, and some people talking about gabapentin. So you've absolutely covered that side of things as well. That was going to be my last question, but you've perfectly covered that. So that's really, I say, it's a really great thing that we have available now, isn't it, to us as well, rather than having to do a full sedation as such, like we used to.
Absolutely.
If we really have to.
Yeah, such a difference. And in terms of, just to add on the sedation front as well, but if you do need more sedation after the gabapentin, you can do that, but just use a lower dose, because your cat's starting from generally a more sedate place. So you can go on to use, for example, your ketamine midazolam or your alfaxan butorphanol is also quite a nice combination for sedating those sort of older, more fragile cats as well. But you can use that after gabapentin if you need to, but just tend to need a much lower dose.
Fantastic. Well, thank you very much, Sarah. I absolutely appreciate your time this evening, and know that we have people from all over the world that have logged in. Some people it's very early in the morning, very late at night. I really appreciate your time and an absolutely brilliant presentation as usual that we would come to expect from you. So it's great. I mean, I love the older cats like you. They can be a challenge to us, but they're also such a joy as well at the same time, aren't they? So it's great to hear your top tips on what we can do for them as not only as vets and nurses, but also as cat owners ourselves as well. So absolutely brilliant, and thank you so much for your time.
My pleasure. Thank everyone for listening, and I'm just I hope it's not been too early or too late wherever you are. But I'm delighted that there's been so many questions as well. That's
really engaging, and lots of thank yous coming through in the chat. So obviously everyone's found it really useful, which is the purpose of us being here. So we've done our job. So of course I also want to just say thank you to everyone who has logged in for this session as well, for all your lovely questions and all the chat that's been going on between you and helping each other out as well at the same time, which is really nice to see that it's really kind of got a real kind of community feel about it. So that's really nice side of things as well. Now, don't forget we have been recording this whole session, so it will be available to watch fairly shortly. Give me a few minutes just to get it up and running, but you can come back in about sort of 15 minutes or so and you'll be able to watch it all again from the start, and you will still have access to the resources, so your CPD certificate, the PDF of the slides. I've popped the links on to the Cat Care for Life, and I've also just popped on a link to Sarah's vet professional website as well, so everything that we've talked about in the session tonight, you can just click through to the relevant websites and have a look at some point. They will remain there kind of indefinitely as such. So please do visit particularly the Cat Care for Life and Sarah's Vet Professional website as well, because there's so many amazing resources on both of those for both the veterinary professional side of things, but also for cat owners as well. So it's really nice that both these websites cover kind of both angles and is really trying to get everyone working together for the benefit of cats, really. So please do take the time for those. So just to wrap it up, I hope you all enjoyed the session. We have more of these planned for 2021, so do keep an eye out on our website and social media, and as soon as we've got everything confirmed and booked in, then we will be advertising on there, and you can sign up and listen to lots more great webinars on all things cats. I know 2020 has been a pretty difficult year for all of us, really, but seeing as we are getting to the end of it, and there seems to be a kind of a light at the end of the tunnel for most of us, then I just want to take the opportunity to wish you a much better 2021, and I'll hopefully see you on another webinar then. But until then, goodbye.